All right, well, we will get started then. It sounds like Jason gave me the thumbs up that we are good to go. Good afternoon, everyone. Paula Kaiser Van Dam. I'm sitting in for Kelly Rose while she's still out on medical leave. So thank you all for coming. And it doesn't appear as if we have anybody in the Detroit office, everybody here in person, and then I do believe we have some folks online, correct, Jason?
Yeah, we have, you can see over here on the screen on the right that we've got, looks like 6 people called in.
Okay, great. Well, thank you for joining us online. We will move through the agenda and conduct kind of the official business, and then after that, we will have time for public comment. So for all those joining us that aren't part of the board, we welcome your comments at such time, which looks like it's towards the very end of the meeting. So hopefully you can stick with us until then. Any questions on the format before we get started? Okay, hearing none. First item would be the approval of the agenda for today. Okay, Michelle moves. Need a second.
Second.
Okay, thank you. We have approval and a motion to approve and a second. All in favor of approving the agenda, say aye.
Aye.
Aye. Any opposed? Same sign. Okay. Next item will be the approval of the December meeting minutes.
So moved.
Okay. Marion?
Second.
Second, okay. Erica seconded. Okay. Any discussion or changes related to that? Okay. Hearing none, all in favor of the approval of the December meeting minutes, say aye.
Aye.
Any opposed, same sign. Okay, so passed. Great. Next up is Lindsay Bishop Gilmore. There is a change. At the December meeting, if you recall, we voted on the policy council roster because there was a retooling of that. And there was, they're wanting to withdraw a membership from an individual who they continued to try to contact and was not communicative. So obviously is no longer interested in the position, and to replace it with a recommendation of another applicant. So I will turn it over to Lindsay for that.
Thank you. Hi, everybody. I can see your little faces very far away. My name is Lindsay Bishop Gilmore. I work at CSH, and I work with the campaign's membership committee, and I'm bringing a recommendation from that committee to withdraw the membership. In December, you all approved the membership of 26 people. We had one person, Sierra O'Donnell, who was within the people with lived experience category, who did not respond to Jason Weller's many attempts to call her, email her, text her, and even sending snail mail. And so we tried that over a couple of months and did not get any responses. And so we are looking for this body to kind of take the person that was the next top person that we reviewed during the categories to be approved to fill that slot of another person with lived experience. And that person is Aisha Wilson. And that would have her term going until the end of 2026. So that would fill another slot within the people with lived experience category on the policy council. And I'm happy to answer any questions that you may have, or if you have questions around the process. I know Jason can share his many attempts.
Any questions? Do we need a motion, or how did we do? We do need a motion.
Yeah,
So,
that's why I included the link. We would need a motion to rescind the offer of membership to Sierra O'Donnell and replace it.
So we need to vote on two things, or can it be the same?
I think we can do one.
Okay.
I think if we just, if the motion
Then
is, to rescind and then offer it to Aisha, I think we're good.
Okay. Anybody willing to make a motion?
I will motion to withdraw the membership offer to Sierra McDonald and extend it to Aisha Wilson.
Second?
Second.
Okay. So we have a motion and a second. Any questions or discussion? Okay, hearing none. All in favor of withdrawing the offer to Sierra O'Donnell and extending it to Aisha Wilson, say aye.
Aye.
Any opposition, same sign. Okay,
Thank you.
motion carries. You're welcome. Okay, our next item on the agenda is going to be kind of multi-pronged, and it's related to the campaign to end homelessness. And the first item, as part of that campaign update, is related to the 2022 annual report. So as you know, every year the campaign works to put together a data report that kind of gives us the state of homelessness, and then it's published on an annual basis. So this is for 2022. I mean, I know we're in 2024, so we're always a year behind because of the way the data works. But we're going to have, believe Jerry is going to walk us through some highlights related to the 2022 data. And Jason, will you remind me, when did we release this? December?
Yeah, it was mid-December of last year.
Okay. And typically it's released September, October-ish, so we were a little late in getting it out last year for a variety of reasons. But so it may seem like it's old, but it really is. It was only released a few months ago, so. Yeah. So, all right, Jerry.
Yeah, Jason, could you give me presenter functionality here?
Give me a second. It made it look like everybody was promoted this time, but apparently not.
There we go.
All right, Jerry, you should be good to go. Yep.
I've got it. Let me go ahead and do this here just a moment. So can you see my screen here?
We can't. Yeah, perfect.
Perfect. Good, good. Well, welcome, everybody. I'm glad that I could join you today. And I wanted to make this presentation two-pronged briefly. So I know many of you, if not most of you, are familiar with what HMIS is, but there may be some in the room that are not familiar what HMIS is, and I wanted to give a very brief overview of it so you understand how we collect data on homelessness in the state of Michigan. And then we're going to circle from that, since HMIS is one of the core contributing data sources for the 2022 annual report. We'll begin discussing what some of the findings of the 2022 annual report look like. So first of all, HMIS, what is it and why is it important? So HMIS is an acronym that stands for the Homeless Management Information System. And the simple way to think about it is it's a client-level database that collects information about persons who are at risk for or experiencing homelessness. And in the early 2000s, what Congress did was they mandated that all communities receiving federal dollars for homeless services have an HMI system to track demographics and outcomes for those that they serve. Excuse me a minute. And what ended up happening was over time, other federal partners, such as the Department of Human Services, excuse me for that, also began to mandate that their programs that serve homeless persons begin to participate in the HMIS. And so the HMIS across the country has become the primary data system that information on homelessness is collected within. So HMIS in Michigan. In Michigan, we are one of the few places nationwide that has a single HMIS that covers the entire state. So if you take a look at other states where, for example, California is a great example of this. In California, they have 40 different HMISs that are assigned to each of their continuums of care or local strategic bodies that do work around homelessness. And one of the things that California is having to do right now is create a massive data warehouse under the leadership of Gavin Newsom's administration to begin to bring all that homeless data together to begin to even understand what homelessness looks like in the state of California. We are very fortunate in Michigan because we only have a single system which allows us to easily look at data across the entire state without having to integrate or combine data from multiple HMISs. And that also permits us, and some of you may be aware of this, and we've been doing some wonderful work in the past several years on data integration work within DHHS, for example, where we are able to look at the intersectionality of multiple social service disciplines. The big area we put a lot of emphasis on has been housing and healthcare over the past couple of years, so that we can better understand how homelessness affects persons' access to healthcare and vice versa, how healthcare may be impacted by somebody's episodes of homelessness. So one of the big things about Michigan's HMI system is we have one of the strongest privacy rules in the nation. This is by design, and this is very intentional. Because one of the things that we wanted to do since the beginning is we wanted to ensure that healthcare providers, so for example, HIPAA-covered entities, mental health providers, and substance use providers can use the system and also remain compliant with the federal and state laws governing them. Within the Michigan HMIS, and we call it MISHMIS, or the Michigan statewide HMIS, we can permit utilization of the system by all of these types of providers, meaning that if they're serving homeless populations, but still under, let's say, for instance, the HIPAA covered entity regulations, that they can align the system to match their HIPAA regulations and participate in the system. This also means, and this is more from an ethical standpoint, is that those we serve, we can permit them to have the strongest privacy protections possible so they can be confident in the security of their personal information. Anybody who's worked in homeless services on the front lines or directly with clients over the years know that one of the biggest things to ensure that we're doing an effective job is to build a relationship of trust with somebody who's experiencing homelessness. Ensuring that we protect that information about them and we're using it in ways that help those individuals experiencing homelessness and not harm them is one of the key ways that we do that, and our privacy rule permits us to do exactly that. So just from a technical standpoint, MISHMIS uses a software package called Community Services, which is a product of a company called WellSky, which is an organization which creates a lot of healthcare and data tracking systems for underserved populations, as well as the HMIS platform, of course. We also have an advanced reporting warehouse that we use, created by a company named Green River, known as the Michigan HMIS Data Warehouse. This is the tool where most of the data analysis for Michigan happens. And this data warehouse is really a critical tool because what it allows us to do is, first of all, it's the source for most of the HMIS data that we use in the annual report. But it also allows our local communities across the state of Michigan to break down the data and do the exact same reporting in their local communities so they can understand what is happening in homelessness the same way that we are able to pull data from a statewide perspective. And MISHMIS has approximately 1,900 users statewide that are accessing the system, and those users work in about 500 unique agencies. So let's talk about data and reporting. This is where we're going to get to the 2022 annual report. So throughout the year, we use data in a variety of ways to better understand our successes and challenges in addressing homelessness. A couple of the key areas, number one, is we're going to talk about the statewide annual report on homelessness. And we're also going to talk about, I believe Lindsay's going to talk with us about the progress reporting on the state action plan and the dashboard work we're doing on that. And as I said before, we use this to inform statewide and also local communities on demographics and outcomes through the use of HMIS data. We are also in the process of, we've launched it, but getting communities integrated and using it, a brand new what we call a system pathways tool to help communities understand the effectiveness of people going through their service delivery systems and how effective certain intervention strategies are in addressing issues of homelessness. And so here we are, we're going to talk about the statewide annual report. And most of you are probably familiar with this, but if not, each year the campaign puts out the statewide annual report on preventing and ending homelessness in Michigan. And this report pulls primarily from HMIS data, but we pulled significant chunks of the report from other data sources, such as 211, which is hosted by Michigan United Ways, MDHHS for healthcare and other social services data, education data, domestic violence data. We, in some cases, pull criminal justice and veterans data, et cetera. And this report focuses attention on the successes and the trends from the previous calendar year. And I'm going to shoot over to the annual report right now. And is everybody able to see this now that we moved over?
Yeah.
Perfect. So we're going to do a brief overview of it, but I want to point out some of the major highlights that we saw within the annual report. So I am going to jump down to page number, I believe it's 3, if you're following along. And this is the Michigan homeless population. So this is going to be a breakdown of the change of persons experiencing homelessness between 2021 and 2022, as well as showing where those changes took place along regional lines within the state of Michigan. Now, if you're following along, one thing that I do want to point out is there are a couple factors that are affecting this. And so as you see right here, we saw an 8% increase from 2021 to 2022. I want to say that 8% increase, there are a couple really critical factors to take into account on this. So first of all, in 2021 and in 2020, as many of you may have imagined, because of the COVID pandemic, we saw a significant fall off or drop in the number of people in the state of Michigan experiencing homelessness. That is because of a number of things that happened. Most obviously, we had an eviction moratorium in place, which meant that people who were in housing, who were up for potential eviction for it, the moratorium was an intervention which kept them in housing, even though they may have been up for eviction. That had a very significant impact on our homeless numbers. We saw our homeless numbers in 2020 and 2021 drop pretty significantly because of that. And also, people were linked and connected with family members during the pandemic, in some cases being doubled up with family members or couch surfing with friends. So overall, our homeless numbers, it took a significant drop off in 2021. Now, one of the things that happened as we began to move out of 21 into 2022 is that, first of all, the eviction moratoriums began to clear through the courts. And so people were evicted from housing that were at risk for homelessness. And also, the second thing that happened was because of the recovery funds that came through from federal and state government, of course, there were a lot of resources that were put on the table for those who were seeking homeless assistance through those funds. So we saw a two-pronged increase, number one with the evictions, but then number two with the increase of funds available to help people who were precarious, at risk, and then ultimately becoming homeless, which led to more people coming through our service delivery system. And those were the large contributing factors of why we saw an 8% increase in 2022. If you look at it on the regional charts, some of the numbers were all over the map as far as significant increases or significant decreases. A lot of that had to do with, in some areas, for example, Region 2 and Region 1, you see that just a couple hundred clients were being served in those areas. And those couple hundred clients, because of the small sampling size, leads to a very large percentage increase. But if you look at it from strictly a number of persons compared to other regions across the state, obviously the numbers are much lower than what you might see in other regions across the state. However, we did see in some of the largely populated areas, for example, Region 10, which would be the Macomb, Oakland, and Wayne County area, a significant increase of 31%. Region 4, which which includes Kent County, we saw an increase of 21%. Region 7, which would be the Lansing, Ingham, Eaton area, did see an increase of 22% in that time frame. So the next thing I want to do is I want to go down, and one of the big priorities we've been focused on, and I know you all have been briefed on this in a number of ways, but we have been for the past couple of years really focused on equity and racial equity within both access to service delivery systems and then outcomes for those who are experiencing homelessness. We have continued to the work that was started with C4 Innovations, which has now become Arc for Justice, to work with partnership with all of our COCs across the state of Michigan, with the Michigan Campaign and with Arc for Justice to do significant work around racial equity. And we have introduced into the annual report and are going to continue evaluating as time goes by key outcome measures for persons experiencing homelessness to see if we are having equity in outcomes for those who may be experiencing homelessness based on race and ethnicity. There are three key measures that we're looking at when we begin talking about that. The first measure is going to be the length of time that an individual or household experiences homelessness. The second measure is going to be people who were exiting homelessness. Are they going to a permanent destination, a temporary destination, or some other types of destinations? So are they exiting from homelessness into permanent housing? And the third measure is going to be then from those who are exiting to permanent housing, are they at some point returning to homelessness? So the first measure we've got right here is this is taking a look at length of time homelessness. And from the light blue markers, the bars here, you can see those are 2021 numbers. To the darker green, they're 2022 numbers. We see that all persons, we had a slight increase from 72 days homeless to 77 days homeless for persons in 2022. Now, looking at this breakdown by race and ethnicity, and what we do when we do the comparisons is we do a comparison of each of the racial subgroups with the entire population, so the all persons. We don't necessarily do a comparison of race against race because we want to know how that race is performing against the whole of the population. So one of the things you're going to notice off the bat is that persons who are Black or African American are experiencing a longer length of time homeless than the average person in the state of Michigan. So it went up from 82 to 86% or 86 days for people who are Black or African American. Those who are white are at 61 and 68 days. So by far, those persons who are Black or African American are experiencing the longest length of time homeless within the system. Now, I do want to say a couple things about this. If you want to look at what the entire size of the homeless population in Michigan looks like. So those who are Black or African American make up just about 13.5% of the total population of the state of Michigan. I believe white persons make up about 74, 75, and correct me if somebody knows or if I'm wrong on that one, but about 74, 75% of the population of the state of Michigan and other racial or ethnic group. And that 74, 75 is going to be white, non-Hispanic, non-Latino. And then the remainder of the population is made up of the other groups divided within them. So as we look at the homeless population, one thing that we know is that 45% of persons in Michigan experiencing homelessness are white. 45% of persons experiencing homelessness are Black or African American, and the other 10% are going to be the other racial groups that break down the state of Michigan here. So one of the things we see is that Black or African American persons are drastically overrepresented within the homeless population within the state of Michigan. The odds, I believe, are about 4 times more likely that you're Black or African American that you're going to experience homelessness in the state of Michigan versus the general population based on those statistics. Now, there's one thing that is really important. I want to have us put a pin in this. Take a look at the American Indian, Alaska Native, or Indigenous population. We see they went from 60 to 63 days, so they're well below the average. But I want you to put a pin in that subpopulation because we're going to talk about them in just a moment. So the next thing I'm going to do is I'm going to drop down from measure 1, and the measures, and you're going to ask why measure 1, measure 2, and measure 7, where do these numbers come from? Because obviously they're out of order. This is actually the measure number assignment that HUD gives to each of these outcome measures. So as you see them, even though they're not consecutive, it's linked to the HUD measure, so that way communities can compare their outcomes to the outcomes that we're publishing here in the report. I'm going to, for just a moment, skip over measure 2 and come back to it. We're going to go down to measure 7. And so this is going to be essentially the successful placement from street out, or successful placement of persons into some form of permanent housing. And I want to look at the bottom 2 areas. So the first one is going to be people exiting emergency shelter, transitional housing, or rapid rehousing that do not move into the rapid rehousing project. So that would mean that they don't find housing through the project, but they exit to some other form of housing. The second outcome is going to be the one below. This is going to look at people in permanent housing, whether that be PSH, who have found housing in the program, or rapid rehousing, who found housing in the program. This is going to measure whether or not they retain housing in that program during the year, or they exit to a permanent housing destination. So we're going to take a look at the first one, and there is one typo I do need to point out. If you look at the chart, you're going to see 2 whites here. There's going to be one about halfway down the chart, and then one about 1 from the bottom, just above multiracial. This is a typo here. The middle white, the one between Black, African American, or African, and the American Indian, Alaskan Native, or Indigenous, this should actually be Asian and Asian American. So that's a typo. This is Asian and Asian American, and the bottom one is going to be the outcomes for persons who are white. So taking a look at this, one of the things that does jump out from the data is even though persons who are Black or African American have longer lengths of time homeless, we see that when compared to all persons, so all persons, we're looking at 46% here, exit to some form of permanent destination. Black or African American persons discharged at a 3% higher rate or more positive destinations than all persons, meaning that they have more positive outcomes than the general population here. This is one thing that we have seen. It's not just a Michigan thing. We've talked to a few other states where we have also seen the same trend. And one of the common factors we see in this trend is that for communities that have a diverse array of resources that are able to meet the unique needs of the households that are coming into them, say, for instance, in a more urban environment that is more resourced, we typically will see Black or African American households outperforming when it comes to discharge destinations, the populations as a whole, meaning that they have better outcomes in this case. So one thing we do see, though, is African American households can discharge at a lower rate on average if they're in more rural environments where they're more limited resources, but in more urban environments that are better resourced, they have better outcomes when it comes to positive discharge destinations. Now, remember where I told you to put a pin on the issue with American Indian, Alaskan Native, or Indigenous? If we look down here, we see, of course, that all persons exiting to positive destinations is 46%. We find that our persons who are American Indian, Alaskan Native, or Indigenous, they exit in 2022 at a rate of 37%. They're almost a full 10 points lower in discharging to positive destinations in housing over the general population. We are seeing that there is a significant performance discrepancy, even though our Native American populations and the state as a whole is a smaller population. We're seeing some significant disparities in performance within our Native American populations. And this is one thing that I've been saying to the campaign and talking to local communities about quite a bit, is this is something that we need to begin to take a look at a statewide level, as well as at local community levels, so we can better understand where that disparity is coming from. Now, I'm going to jump back up, and I know that we're short on time here for my portion of the presentation, but the one thing that I do want to talk about, so this is a return to homelessness. This is the measure 2 for those who have exited to a permanent destination. We only show on here persons who are Black or persons who are white. compared to all persons, and the numbers in 2022 was 20.9%. What we see is there isn't a really statistically significant difference. So Black households or persons tend to return to homelessness at a slightly higher rate, but it's only just a little bit over half a percentage point, which isn't statistically significant. Whereas white households tend to return at just about half a percentage point underneath. But again, this is it is a trend, but I wouldn't say that is statistically significant. One thing that is not listed on here that I want to refer, going back to what we were talking about below, is the fact that if you look at Native American indigenous households, they are returning to homelessness at a rate of approximately 30%, which again is about 10 percentage points higher than the average that we see within this measure. So that again is another place where we're seeing that those who are Native American, First Nations people within Michigan, they are discharging to permanent destinations at a rate almost 10% lower, and they have a return to homelessness rate that is almost 10% higher than the general population. And so that's one of the key takeaways that I really want to point out from this as we look at the data around racial equity and do the evaluation around this work. So Jason, I know we're short on time and we want to move over to Lindsay, but is there any questions that anybody would have or anything we'd want to talk about additionally?
One of them was the strategic performance dashboard.
Oh, yeah, Jerry, can you share, so it's on the campaign website. I know we just touched on some of the data from the dashboard, but can you switch to the action plan page of the website? Or do you need me to pull that up for you?
While we're doing that, are there reactions to the data or questions people want to ask related to the data? Erica?
Oh, no, I just know Region 8 is incorrect.
You know what?
Region 8 is incorrect.
Oh, the data for Region 8?
Yeah, we didn't include our gospel mission data, so that would actually probably increase the overall.
Okay.
They stopped using HMS and they have 5.5.
So it would be much higher, you're saying, if
Yeah.
that was included?
Yeah, it was, we discussed at our COC board meeting.
Yeah.
Was that included in the 2021 data, that mission? It should have been. We just
Yeah.
missed this last year because they switched over and stopped using HMIS.
Yeah.
And it didn't get put into, that's why the number looks so,
Yeah.
like for ending homelessness, it wasn't that great.
So that's the solution.
So are they reusing it now?
They
or
will this next year, so you're gonna see a huge jump
When they
when
start
we do the
using it
next
again?
report, yeah. They're not gonna
They'll-
use HMIS, they're gonna have to, the COC is gonna have to import somehow.
Some
yeah.
kind of data. Got it. Okay.
It would be nice to have a way, though, to capture in the report where there's additional information that would be good to know.
Yeah, I was worried about it because it made it, I was like, it could affect our funding.
With the numbers.
Yeah, it
like
looks like, oh, they're doing a good job,
improved.
they don't.
Right.
Yeah. So sometimes like asterisking the data you're
Yes.
saying.
Yeah,
Yeah.
I know, it's kind of weird, I looked up, like, oh.
Other, observations or questions or comments related to what Jerry went through related to the data? I mean, I think when we see the 23 data, I think we still think we're continuing to see an increase, not
Mhm.
overall for the state, not a decrease. So I think we're still anticipating, kind of given the rising housing costs, given the limited availability of affordable housing, also as a lot of the extra COVID money that communities received has been expended, and we're back to sort of level funding of what we had pre-COVID. I think that's also contributing because the resources just
Yeah.
aren't there, especially on the prevention side, which a lot of the COVID money was focused on the prevention side, like a lot of eviction diversion related kinds of things. It's just simply not there right now. So I think that's making, that's what's kind of driving the ongoing numbers. So, if you look on the screen, I think that's the dashboard related to the performance measures. As you can see, with the big 8% and the 21% increases, if you could read underneath it, it's showing that we're going in the wrong direction.
Yeah, I noticed that almost all of them
Yeah.
were going.
So one point that Paula, that I think will be helpful to make, and let me just say this, first of all, we are in the middle of federal reporting, and so data is all over the place until we wrap up federal reporting. But I've taken an initial look, and I want to say this is a really rough draft look at the 2023 data, and we have, by the initial look at it, increased, but it's a very slight increase, almost to the point where we are flat within the data from 2022 to 2023.
Well, that's good. We'll take that, I guess,
Yeah.
and,
Yeah.
you know, continued increase, so. Good. Okay, any other questions or anything specific about the dashboard that you want highlighted or pointed out?
I guess I'm just curious in regard to the way that the data is communicated through the report, what our hopes are from a policy perspective in sharing the information at the subpopulation level that we are. It's interesting, but our report doesn't include any real implications of why we've emphasized the difference in subpopulation and how that might influence policy. And I guess the reason I bring that up is that in another context that I operate in, we're having a conversation around the disproportionate impact of, say, climate change on different subpopulations as well. And the question we were discussing is, to what degree does the way that we communicate about disparate impact potentially undermine our efforts to change public policy when supporters of public policy to defund response are even less likely, in some cases, to support a more robust response if they believe the issue disproportionately doesn't affect them?
Interesting.
And I'm just curious how we're translating this data to its intended audience, I guess.
Yeah, I mean, I think that's a good question. I think the annual report has taken many iterations over the years and has been either shorter or longer or whatever. And I do think that, like, spending some time, talking through and thinking about what is the intended purpose, who's the audience, what is it that we're really trying to accomplish through this, makes sense. There is a, group that sort of works on it, but I think at this level, right, as we sort of think about things like the budgetary, asks that we advance to the governor's office for consideration related to this work in space, et cetera, like, how can these tools, I would call them, all sort of align to help present the case in some ways for some of the things that we're sort of asking for, and not just being, just a presentation of a collection of data points, right? That it's like, there's sort of an intended strategy within it in terms of what it is that we're trying to do. Obviously, the racial equity work has been a big focus of the work that sort of happened both at the state and local communities, and even within the 3-year action plan, there were some specific items within that. So I think that was sort of one of the reasons that it has such a strong focus in the 2022 report. But I think we have opportunities to definitely influence what the 23 report looks like, and what we'd like to see as part of that.
That makes sense.
Craig, did you have thoughts? I see your brain turning down there.
I like the point, though. I always, data's great, but messaging is always key, and who are we trying to speak to?
Right.
What are we trying to say? What are we trying to accomplish? You can get just lost in data.
Yeah, I think another way of thinking about this is that the fact that there's disproportionate impact and the fact that there's a problem at all that's disproportionately impacting people, there's different interests that would potentially overlap or potentially not who might have an interest in responding to both of those topics. And we may, in some cases, by conflating the issue, work against ourselves in regard to making a certain case, so depending on the political implications. I think both need to be addressed.
Yeah.
Yeah.
Okay. Other thoughts, comments related to that? Okay. We'll make sure that maybe on the, next meeting agenda, we circle back about the 2023 report and any
Good
kind
idea.
of strategy or messaging or, I mean, obviously we want it, we want to kind of have a sense of the data and what it's telling us, but then how do we use that around some strategic messaging, et cetera, related to that, so, great. All right, thank you. Next item under how the campaign is doing is progress related to, some of the, action items in the 3-year action plan. So I'm going to turn it back over to Lindsay for that component. And
Thanks.
thank you, Jerry, for your presentation.
You're welcome.
Thanks again for letting me be with you all today. So right below the colorful charts that Jerry was walking through and that you all were just talking about on the website, there's also a progress report, which is really exciting, that shows the progress that's been made on the action plan. And so you click on that to get to it, and then this is what it looks like. And so I just wanted you all to know that this is here, so it provides a kind of at a glimpse. It's not super long. At a glimpse, where are we making progress? And then perhaps where do we need to focus some of our energy? And so in the agenda, a few different goals and strategies were outlined. And so just want to spend some time kind of walking through those and have some of the champions speak about them as well. And then also want to ask you all kind of what your observations and reflections are kind of after we go through a few of these different strategies and goals. So the first two that I wanted to highlight that are in the agenda are under goal 1, which is increasing the amount of safe, accessible, and affordable housing. And so those two strategies are strategy 6 and 7. And those are where Mishra is the lead or the champion on strategy 6, which is related to expanding moving on. So helping folks that are in supportive housing and stable move on and freeing up that supportive housing subsidy and services for someone to exit from homelessness. And this has happened in a few different communities that Mishra has led. And so there isn't any progress to date on this one. And then the second one is identify and fund emerging housing models. And so this was shared housing, host homes were examples that were provided to think about filling the gap for people experiencing homelessness. And Mike is the champion on this one. And I don't know if there's anything else that you would like to add on this one, Eric, but wanted to kind of bring people's attention to this. And Jason, we're identifying the ones where there hasn't been specific progress outlined, correct?
Yes, although if there's other things that you want to highlight along the way as you give the guidance for it, that would be welcome as well.
Okay. Yeah, so we wanted, to kind of bring people's attention to where there hasn't been progress made or that there's not progress to report, just so it's on your all's radar as the action plan is kind of guiding the work. And so, is Lisa on to talk about goal 2?
Yeah.
Okay,
Lisa
cool.
Kidman?
Chapman.
Oh,
Lisa
Lisa Chapman, sorry.
Yeah.
Sorry, wrong Lisa, okay.
Well, Lisa is away in DC. gonna be doing some work with members of Congress, so I'm
Awesome.
filling
Okay.
in her stead.
Awesome. Okay. So I'll walk through the ones that we don't necessarily have any progress to report to kind of bring your awareness around it, and then we can come back and have a more kind of detailed conversation. So the second one, the second goal around preventing homelessness, the first strategy was to identify more robust tenancy supports and protections such as legal aid, mediation, to really help prevent eviction if at all possible. This was the only one within this category where there hasn't been any progress made. And then angle 3, which is around collaboration between local communities and statewide systems. There's only one, and I want to acknowledge that we have listed here that there's not progress to report, and that doesn't mean that there's not actually progress. It means that we haven't been able to kind of nail down what that progress is, and it may be happening at the local level, and that information isn't available to us. So this is what we have been able to receive and pull together based on the feedback that was provided. So under this one, the one where we haven't been able to get progress is around leveraging domestic violence kind of databases to strengthen the connection between DV agencies and homeless service providers to really improve homeless safety planning. So really kind of building those stronger connections with the DV systems, knowing that the data is not included in HMIS as well. And then,
So, hey, Lindsay, can we just have, just for people sitting around the table, a little more background on that particular issue? So because of the confidentiality requirements related to survivors of domestic violence, they cannot utilize HMIS as it is currently designed. So they have to come up with a different system that's comparable and can collect the information that's sort of needed in order to be able to continue to receive HUD funding related to homelessness, right? So for those DV agencies that want to continue to, some of them receive things like rapid rehousing dollars through their COC, things like that. And so in order for them to be able to receive those dollars in the future, HUD has made a requirement that you have to have a comparable database. And then MSHDA also provides some of their ESG funding that they receive to domestic violence shelters as sort of a set aside, and they have that requirement as well for those agencies that are going to receive those ESG dollars. Is that correct, Lisa? I'm looking at you. Yes. Okay, correct. Thank you.
Yes.
Okay.
And Paula,
so
let me
just to give-
put, I was going to add one quick addition to that as well. One thing that we have been doing some additional work with DV agencies quite a bit at a state level through the coalition. We had a bit of a setback in the past year, but we're still looking to move that initiative forward. The second thing that is worth mentioning, though, even though the DV agencies can't participate directly themselves, in many communities, DV clients will be referred over to the HARAs or the main stream coordinated entry systems, or they'll receive services in the mainstream shelters within the agencies. So we are able to get, to a degree, some data on DV. It's just that we don't have the full picture as pictured by the DV agencies since they can't participate in HMIS.
Yeah, okay, thank you.
Yeah.
And there was a project where there was some money that was provided by MSHDA to allow the purchase of a comparable database, and there was a work group that came together through the DV Coalition to look at a variety of options, and they came up with a solution that this work group embraced, and they were moving forward with sort of the purchase of this technology solution, and then the company was sold, I believe, to a different tech entity who no longer was going to sort of support that specific solution. You know, welcome to the tech world. It happens sort of all the time, unfortunately. And so they had to sort of, I would say, you know, just move to it in a different direction, right? Because it no longer made sense to purchase that solution. And so then, it's my understanding, many grants were sort of given to the DD agencies who were gonna, be part of that pilot and using that new system to find their own sort of solution based on criteria. Is that correct, Lisa?
That's correct.
So I think we just need some updates related to kind of where folks are, and then how do we, continue to kind of leverage that information. But I think we can easily put some bullets here related to some of those solutions. Okay,
Yeah.
sorry,
Thanks.
Lindsay, keep
No,
going.
no, please, thank you for that context. I know looking at a scrolling page on the website is not fine, so I hope you all have this downloaded and memorized. The other area where there hasn't been kind of progress reported, did I just miss it? Oh, here we go. It's on the very last page, and this is around authentically engaging people with lived experience and ongoing partnerships. And this is to access funding administered by state level public funders for equity when comparing demographic data and per capita homeless data statewide in order to understand and address disparities in funding. And so this is kind of looking at the various funding that has been pulled together. And that second strategy is really based, I think, on the first strategy. And that is one where there is progress that is being made. And so this was one that the ICH was identified as the champion with the Policy Council. And this was to increase transparency by making the funding allocations that are related to homelessness, to that MSHA funds, MDHHS funds, any other statewide department, to make those funding allocations and the performance metrics available kind of publicly. And some of that already is available publicly, but it's very scattered. HUD makes all of the continuum of care funding requirement or funding allocations public, and so that the data may be out there, but it's not kind of available in an easy to use and navigate space. And so last year a reporting template was made to start collecting this data from the various state departments, to then complete that and publish that. And then I think it's looking at that data to work on strategy 2. And so those are the areas where we don't have any progress to report. There's a number of areas where we have made really great progress. And I'm wondering if any of the champions want to kind of speak to those, or Jason, if you wanted folks to speak about specific other ones.
I know that, as Eric said, I know Lisa's not here, but he is ready to give an update on some of the work that Mike has been doing, both areas of success and challenges. So maybe we could hand things off to Eric.
Sure. Go ahead, Eric.
Sorry, trying to find my mute. So which specific goal and strategy did you want me to talk about?
I thought you were ready to talk. Did you want to talk about this Goal 2, Strategy 1 around the tenant supports and protections and the work that you guys are doing around that?
Yeah, sorry, I was just looking at what was on the screen, so I didn't know if that was what you wanted me to cover or not. So didn't want to launch into something and be off track already. So okay, so talking about goal number 2, is that where you're at?
I think Jason and Paula, you said goal number 1,
Goal
strategy
2,
4.
Strategy 1. Goal 2, Strategy 1, I think, was the one
yes.
Right. Yeah. Thank you. Yeah, so you can see there, we're involved in a lot of work focused on advocacy, and Lisa Chapman is our lead person on it, but I'm going to fill in some of the gaps based on what I know. She has a lot more of the detail on it, but certainly when we talk about the tenant protections, that is something we're highly focused on, both as an individual, but also through collaborations that we have with other partners. So we facilitate the Coalition for Expanding Housing Access, and that's a group of about 125 different advocates around the state that are working for the passage of tenant protections. And those tenant protections include source of income protections. That group meets every second and fourth Tuesday at 10 o'clock. Everybody is welcome. If you're interested, you're certainly welcome to attend those. And those source of income bills have passed through the Senate committee and await action in the House Judiciary Committee. So we're seeing some traction with those. And we see that as a really significant issue, particularly when we're thinking in terms of housing choice vouchers and the challenge that many folks have in actually trying to access housing when they do have an HCV award. Also, just more broadly, when we think about some of the other legislation that's taking place, we're monitoring and engaged in at least 39 housing-related bills that have been introduced just in this legislature. So one has passed the session so far, was signed into law. That was House Bill 4273, and that was relating to code violations and notifying tenants when that does take place, so there aren't any surprises. Other bills include a mold in housing legislation. Another is eviction expungement, but then also better management of the rental application process itself. So a number of ways that we're looking at trying to help people access housing and or keep them in their housing, reduce housing loss. We're also participating in a number of other coalitions that are focused on advocacy, including the Fair Chance Access to Housing Bill, which is, it provides some critical protections when we think in terms of housing discrimination based on prior criminal history, and that regulates the use of criminal background checks in that process. Also, manufactured housing bills. Hopefully, you're all aware of the impact of manufactured housing with respect to trying to prevent the sale and then subsequent rent gouging that's been taking place, where people are losing their housing as a result of rent surges that are taking place or out of their control. So we're looking for better oversight, improving leases, and stopping unfair seizures of those homes, which is taking place much more significantly than it has ever been in the past. And then racial equity impact analysis of any social determinants of health legislation is a key piece of legislation that we're focusing on. So that's giving you a variety of the things that we're working on that we think fall underneath this category, this goal, and this strategy. Happy to answer any questions, but again, I'm just trying to give you an overview of the wide range of things that are taking place, even though when you look at this strategy, we don't have necessarily the clarity that you might be looking for in the description. There's still a lot going on with advocacy.
Any
Thanks,
questions any questions for Eric related to that? It would be great, Eric, if we could just kind of keep updated on where the status of those different pieces of legislation, even us just sort of have a brief description of the specific bills and what they're covering and et cetera, I think would be great if you or Lisa would be willing to put that together. And then I don't know if you want to also just make a plug for your advocacy day while we're all here.
Oh, yeah, thank you for that. I appreciate you mentioning that. I did want to just indicate that we do have some tracking information that we can make available to you that does give an overview of some of the pieces of legislation I've talked about and can give some updates on what's happening. So happy to do that. You just let me know what the best way is for that to happen. And I don't know, Jason, if you would be able to help guide me on that after this meeting, we can make that happen. But with respect to our Advocacy Day, thank you, Paula. We do have our annual Homelessness Advocacy Day taking place on the 23rd of April. It's going to be at Lansing Community College. We're very pleased to be conducting it in person. Again, we are expecting about 150 people to participate. Everyone is welcome. You all are welcome to participate if you are so interested. We spend some time in the morning talking about some of the key pieces of legislation and talking points, and then we have visits with the House scheduled or will be scheduled in the morning, and then in the afternoon, first half of the afternoon, we have the Senate appointments take place, and then folks do trickle back in, and we do some debriefing along the way. It's a very important way for us to get our issues out in front of the legislators that we engage with on a regular basis. So that's about it. Happy to toss a link in the chat as well, or I get it to Jason, he can send it out via email to everybody.
Yeah, I think if schedules allow, I mean, as members of the ICH, if you could participate in the morning part of the advocacy day, I think that would be great. Just as a way to just lend support and thank our providers who are going to show up and go do those legislative visits. Obviously, those of us that are in state government are sort of limited in what we can do around advocacy, and so they are kind of the extension of, and the, you know, boots on the ground that help us sort of get over the finish line on some of these key issues. And I know we've been in discussion with Micah around alignment of what they're sort of pushing for with what was included in the governor's letter that we sent from the ICH, so that there is some, you know, overlap there, and it's not they're off asking for something that we didn't ask for. So it will be an opportunity to not only include the items that we were lucky enough to get in the governor's budget, but they will continue to push for items that didn't make it in the governor's budget as well, which we all know those of us in state government seats can't continue to do, right? Once her budget comes out, it's our job to support what's in her budget. So, you know, so having folks there to kind of continue to push on some of those items that unfortunately didn't make it in to her budget will be great. So if your schedule allows, it would be great to be there. So Jason will get the information and get it sent out to folks so you can get registered for that. So thank you. Okay, Lindsay, anything else related to action plan progress?
Yeah, I had two questions. Well, one thing and a question. One other kind of piece that because I'm here and I have an opportunity to talk, I just wanted to highlight one of the strategies that we're championing. And as you're advocating, and as Mike is advocating, and others, it was included in the governor's budget request around 25 million for supportive housing services, which is strategy 5. We were fortunate enough, CSH has been leading this, engaging a lot with supportive housing providers. We were excited that the governor included 20 million in her budget. We are continuing on the legislative approach to identify other potential funding sources for the services funding that would be a little bit easier for supportive housing service providers to use. And so we're excited to see progress on that specific goal and strategy as well.
Can I just add to that, Lindsay, for just 1 second? So actually the 20 million was in a supplemental for the current fiscal year. Oh. So it's not in the FY25 bill, and it is ARPA money, right? So there are some limitations to that source of funding that was attached to that 20 million if it were to get passed, because of the time frame that those ARPA dollars have to be spent. So it wouldn't afford us kind of the same that the $6 million general fund pilot that we got in this fiscal year, 23, allows us to do. So just want to keep that in mind. We're always happy to see money in any budget related to supportive services, but there are some constraints that would come if it's passed as it was introduced in that supplemental.
Absolutely, and that's why we're continuing on the legislative approach. We also have interest from a couple of the policy committees in both the House and the Senate to hold hearings on supportive housing, just to raise awareness among our legislators of what supportive housing is, because we are learning through our visits that there's a lot of myths, and also folks really should have an opportunity to kind of learn more about it. Yeah, and so we're definitely pushing forward, knowing the constraints from the supplemental. Yeah, the last thing is this tracking form is the first time that the action plan, the campaign, has had kind of a tracking form that looks like this for every single goal and strategy. So I'm curious, having looked at it, having seen it, if you all have thoughts, reaction, feedback. Do you find kind of this structure helpful? Is there ways that this kind of progress report can be utilized kind of moving forward? Just wanted to ask, since this was the first time that something like this has been put together.
feedback related to it?
I like the format. I think it's really straightforward, easy to read, easy to follow, and it keeps us on task.
Thank you.
I also like the format. I think it's great that we finally found a format that we could utilize. I think we've had many attempts at this with previous plans, and so I think it's easy to read. It's great. I do think that, like, I would love to see, like, if something has been, like, fully implemented, is there a color coding of sorts that sort of says, like, this is done? If, you know what I mean? So, like, we can, like, it's checked off, we don't have to pay attention to it any longer. I know that doesn't, maybe that didn't come out the way I meant to, but just, you know, everybody has just a limited amount of time to kind of focus on these items, and I think if we can make it as simple as possible. So if something is completed, maybe it changes colors to something else, and so we know that that means it's done and we don't have to worry about it.
Yeah.
The only other thing I would say is that I think if we have some that are, like, we're behind on in some way, again, some kind of color coding that allows us to kind of be like, oh, these are ones from an ICH level we maybe need to pay a little more attention to or understand why we may be behind in accomplishing this, and are there barriers or things we want to do to remove the barriers or whatever that's sort of standing in the way of that. And I don't think the way that it sort of currently looks, you know, there isn't any sort of indication of that. So those would be my only two other suggestions.
Yeah, that's really helpful.
Anybody else? Any other feedback?
I was just gonna add, I really like the fact that there's a narrative response to the progress, because I think sometimes just context matters, and it's an opportunity to do that, right? Yeah. And then I also wonder, just with some of these, with the completion goals having already passed, at what point do we update completion goals to a new target when?
If we missed it, didn't accomplish it.
Yeah, or, Because I'm looking at the September 24th one for MD, and I'm like, that's not gonna happen right now. So, I mean, but we're doing a lot of good conversation around that and trying to figure out how to systematize soft handoff, warm handoff kind of things. So we've taken the strategy a little bit and morphed it to actually move us more in the direction that we think is aligned to that. But I don't think September 24th is going to be a realistic date. And so how do we do that?
Update that. And we could, Lindsay, just do like original completion date, but then like the new one or something, just so we have a way of tracking that, like, it's still in progress. And then to me, if there is, I mean, the other thing about, like, when you put together a 3-year plan, you do the best that you can, you know, in terms of how you want to do this. And there may be times when it's like what we put on there is not relevant any longer. There's something that's changed, right?
Yeah.
And so I also think if that is the case, then we just need to, like, somehow indicate that and know, so it doesn't look like we didn't accomplish it, or like if we're not going to pursue it any longer, or if we needed to modify it, that it's just reflected just because of a change in something that's, you know, taking us in a different direction. So just some indication of that as well, but I like that. So maybe it would make sense to go back through, Lindsay, and any that we've missed or that are checking on the ones that are due this calendar year to make sure we're still on target, or if we need to modify any of those dates for within the plan for this year and 25. So
that sounds great. Yeah, thank you so much for this feedback. That is super helpful.
all right. So I think that concludes discussion related to the progress report. We may have taken a little more than 20 minutes, but we're doing our best here. Trying to keep us on track. I need to do a better job of time management, I think, while I sit in for Kelly in this role. So next would be discussions around addressing gaps in the work, and Lindsay is going to continue on in helping facilitate this discussion for us. And I would say that there's been a handful of us who've been meeting to kind of talk about the staffing to the campaign to end homelessness, which also includes this body as well as the Homeless Policy Council. And we had the opportunity to talk to the US ICH, so the federal ICH, in terms of how this work is sort of organized and staffed in other states and sort of what that looks like in comparison to Michigan and in just even how it's somewhat structured as well. And so that conversation was really eye-opening. I was part of that conversation. I know folks from MSHDA were on it as well. I think Micah was represented. I'm trying to think who else was sort of in that conversation with the federal ICH. And I think that, you know, I'll share a couple of things, Lindsay, and then I'll turn it over to you.
Yeah.
I think a couple of things that, you know, that have always been in the back of my mind, and I think they sort of reiterated is because our ICH is created by executive order, we do have some risk in that, because if we have an incoming governor who doesn't want to support it, they, through another executive order, could abolish the existence of this body. And so I think we really heard strongly, and the USICH has seen that happen recently in a state or two, so, and shared that. So I think their recommendation would really be to think about creating legislation where this would be a legislated body that exists in perpetuity. And then I think my other takeaway from the conversation too was, in a lot of states, the staff person or staff people, if there's more than one, sort of sits in the governor's office and sort of plays that more sort of organizing and coordinating sort of role. And, you know, that's clearly not the case in the way that we're organized here, right? It's you know, MSHDA was deemed point for the ICH, they chair it, et cetera, and then the staff position. They've always just, you know, out of the kindness of their heart as an agency, paid for a staff position for the campaign. There's never been sort of any funding or an FTE specifically associated with the body of work. And so I do think, again, that's things that we should have conversation about, just again, from a sustainability perspective and you know, just institutionalizing the work and ensuring that, you know, regardless of who's in office and quite frankly, who's in any of our chairs, that this work is important enough that it should continue. So just having conversations around what we want to see happen and what that could possibly look like and how we like to approach that with the governor's office and other kinds of things, depending on what the outcome looks like for that. So, so I'll stop there, Lindsay, and just wanted to share that from my chair as a member of this body, you know, how being part of that conversation. And I think if you guys want, we could invite the USICH to come and present at one of our meetings so you all could hear that information directly around what it looks like and what it's sort of structured like, et cetera. But I think we should start having that conversation, right? Like, what do we want this body to look like? It's been great, and it's not like there's any risk of now, and obviously under this governor, I don't think we have, but to me, we have a window while we still have a supportive governor, and not knowing who will be in that seat, you know, after these last 3 years, to really start planning and thinking about what it is that may make sense for the long term of this work. So, all right, Lindsay, your turn.
Thanks, Paula. And I just put this on a slide as a way to organize my own thoughts, but the action plan very much does speak to this. We started out the conversation really centered around staffing to implement the plan because that was a commitment that was made in the action plan. And you know, this is a small group, just for transparency's sake, that's been a part of those conversations. And it's definitely evolved over time. I think at first we started talking about just what is the capacity needed and the staffing needs. And to Paula's point, it's very much morphed into structure. And our conversation with Nichelle from USICH was incredibly helpful. You know, I think she identified some of the structural challenges, you know, being an executive order and not legislative, I think is one. And something that I actually think, Paula, maybe you raised this in the meeting, is in other kind of states with a similar sort of structure and setup. You have someone that is not your peer. I think right now you all sitting around the table are all peers, which can then make reporting really hard. And so just acknowledging that and kind of who who is this body kind of reporting to and such. Another kind of important piece that I took away from some of those conversations was just the connection between what the state is doing and then like what local communities are doing. And so for advocacy work, that there is this really strong connection, that the work is moving forward kind of in a very coordinated sort of way. And so I think we developed some questions. Jason, is that where I should move next? And Paula, sorry, into some of the questions that we developed kind of thinking about this, or do you want to talk about the committees first, Jason?
I think let's go ahead and get into the question.
Okay. So Jason included these questions on your agenda. There are 7 questions in total. And we have way too many questions than we can dive into today, and we know that. And so wanted to hear from you all, you know, thinking about the data, thinking about and seeing the action plan progress, what Paula just shared around the conversations with USICH. Are there structural things that we should be focused on? What do we need to really address some of the gaps that exist? How can you kind of in your sphere of influence kind of start to help address some of those gaps? And so in our last few minutes, I had this envision of us working on a Jamboard, or I would write stickies on a Jamboard. But I think we should just have a bit of reflection around how do we best support the work within the action plan? Are there things that are coming to mind for you all that this body can do to really start to think how to move the work forward, how to support the champions that are moving the work forward? So you can look at this list of questions and answer any of them, or just general kind of reflections on how this body supports the action plan work.
And I would say thoughts around just what I sort of teed up in terms of just the longevity of this group and, you know, some of those things. And if you're not ready for that and you think you'd like for us to invite someone from the USICH to come present to us at the next meeting, I think we could certainly see if we could make that happen as well.
I like that idea.
Having somebody come and present.
I'd like to hear what maybe some other states are doing, what they're seeing. I really like the idea of possibly having a discussion about standing up in statute, having that knowledge and that discussion about all the bills that are out there right now shows not only a governor that is supportive, it shows a legislature that's supportive. So if that's something we want to do, it's probably really good timing. But when I look at these questions, and I get the idea of gaps and all that, but I also, before we jump into creating more work, I think we should take a look and reflect on, are there things we're spending time on that maybe we don't need to anymore? So I don't know, to me, that seems like maybe a good exercise to do first. Are there things that maybe we've already settled? I don't know, I just think there's a lot of work that can be done and maybe take off.
And I think that's too what brought up the conversation even around like, we have one staff position that supports the campaign, right? And so in addition to kind of, being the person who helps coordinate these meetings, the monthly Homeless Policy Council meeting, they're also lead on, that position is also lead on, coordinating the development of the annual report, the annual summit that happens, which is another huge list, right? Is like, falls within their job description. So there are all these things that are, really, too much for what one position can do and do effectively. Because in fact, we met jointly with, Lynn and I met with Lisa and Christina from MISHDA just last Friday, and we spent the afternoon really sort of talking about how we as a department at MDHHS could be more helpful in supporting some of the campaign activities, and why we don't necessarily have to have the coordinator role doing all of those things, right? Can we sort of spread some of those duties and responsibilities across Lynn's team or, other folks that I have on my team who could be beneficial, so that so that the coordinating role could do more around the coordinating and some of the strategy kinds of things and some of that kind of work, instead of just being bogged down in a lot of sort of admin, sometimes what it feels like duties, that prevents us from being able to kind of do that. So I respect what you're saying in terms of like, do we still need to do all the stuff we're doing, or is it time to kind of
I completely,
go ahead, Lindsay.
no, I was gonna say, I lost all of I couldn't hear anyone, so was afraid I had missed something.
Oh, I was just saying that, you know, we met with Mishta on Friday, spent the afternoon looking at some of the responsibilities or tasks that fall under the campaign, and looked at how we at MDHHS could begin to provide more staffing support around, you know, some of those duties, so that the coordinator, you know, isn't stuck sort of leading all of that work, and can focus a little bit more on some of the strategy things, et cetera. So we're sort of having, you know, that continued conversation about that. But I think what Craig raised around what should or should not be part of it, you know, is also, I think, an important component to consider. So before adding more work
Yeah.
to an already very full plate, right? At the same time, I do think, like, really understanding, like, what does the work entail? Because then oftentimes that can help lead to, well, then we do need added capacity, right? So it's kind of chicken and egg in some ways, but I think, you know, both of that could be really helpful. You know, I might suggest, like, a couple of things. One would be, maybe it would make sense for us to do more of like a retreat style for the ICH meeting, where we could bring in and then we could spend some time, like, actually thinking and planning and doing some of that work. I don't know, since I've been on this group, that we've done that as a body. And so, you know, just trying to throw that out there. I also would, you know, like to offer, and again, I don't know exactly how we do this, but I was also thinking it might be helpful to create sort of a small executive committee within the ICH. And the reason I say that is that I think it could help around some leadership and some capacity for the coordinator around things like agenda setting, the work that needs to happen in coordination between the Homeless Policy Council and the ICH. The executive committee could take on some of that role, et cetera. So I, you know, just thought it might make sense to just form you know, a very small 3 or 4 people. I mean, we're not a very large body to begin with, so we don't need half the group on that, but that just could give input to agenda setting and the things that people want to cover as part of the ICH meetings, as well as the coordination with the Homeless Policy Council, as well as, you know, whatever else sort of needs to get done. And, you know, that we could come back with a recommendation and some language and duties related to that, if there seems to be some interest associated with the creation of that.
Thoughts or reactions? Sorry.
I was gonna say, that sounds promising. I think that the idea of a retreat focus that would include maybe a presentation from USICH, focus on what the implications might be for our state structure, including the assessment of ideas like an executive committee and how that might work, and how other bodies that are at the table might lend capacity. I think that could all happen in one half-day, day-long retreat, something like that.
Yeah.
I like that idea.
That's an interesting noise.
That is not me, I promise.
No, there's something on the ceiling in this room or something.
Oh,
It
no.
might be a sound effect
Maybe, it could be.
from the Jamboard.
Other reactions to anything that Paula has shared? Are there things that you all feel that you need to have these, I call them deeper conversations. Are there, what are some of the things that you all would like to hear from USICH that could be beneficial? To spur a conversation of what it could look like in Michigan, any changes? What would you like to hear from USICH?
I would like to hear, again, like, structure, right? Like how their state ICHs operate, where they're sort of, how they're administratively housed and supported. And then I'd like to also hear like some of the sort of most effective sort of state strategies that are working in ending and reducing homelessness, right? So getting a little bit into, you know, some of the best practices and some of the things that's working, but also as it relates to what homelessness looks like in our state, right? So like, with all due respect, we don't have a really high unsheltered population. So the strategies that sort of the West Coast is employing around, you know, like, I mean, just like taking into consideration what our homeless population looks like and bringing us sort of strategies and things that are sort of working in other states.
Yeah, I think for me, top of head, staffing, budget, partnerships with any associations that are effective, such as do they have any outreach with business associations on transition, some kind of housing where it's needed for employment. Trying to think of other things I've been thinking about since our last meeting. Those are some.
And when you say staffing and budget, is that the staffing and budget like for the people that are?
Yeah.
Okay.
For standing it up. So do they have 2 or 3 people dedicated to it?
Yep.
Are they full-time? Are they all central in one agency or in the governor's executive office?
And then the source of money paying for it too, not just the budget, but is it general fund money? Is it, are they using some other opioid settlement money? I'm joking, but like, what are they using to pay, you know? Who knows? Tobacco money, right? Like that was a big source of money, many years ago. So, looking at the source of the money too, I think helps us for planning purposes.
Yeah, and I think the question around are all of, if there's multiple staff, are they all in one place or are the duties spread across different organizations? Because I know that there's examples of both, and so I think that's a really great question.
And I think I would love to hear just like, where do we stack up in comparison to other states sort of currently with the work that we're doing? So where are we sort of innovating and doing good work, and then where are we sort of lagging behind in other ways? I'd like to sort of understand that from the USICH's perspective.
Yeah, so where are we in comparison?
On a different note, Lindsay.
Yeah.
Oh, go ahead.
No, please go ahead.
On question 1, when you're asking about gaps, are you thinking like gaps in our state plan or gaps in our progress toward the strategies?
I think gaps in the progress towards the strategies.
Gotcha.
Yeah, I think, you know, we know that we did not include everything that we could have in the action plan. But with the data specifically, do you kind of see other things that are coming up that maybe we're not thinking about?
Because I think there could be a better match in the progress report and the state plan. I mean, I've read them independently, but I never honestly had them sitting next to each other in front of me, so not
Yeah.
exactly your point earlier, Ryan, but about like, what are we doing with the report? Not exactly where you were going with that, but I think the report could better reflect, our strategies and progress toward them, and maybe that's just a built-in structure to keep us on task and address some of the gaps. And then the report could even end with like, here's what we haven't been able to accomplish that we'll need to focus on more going forward.
Yeah, that's really interesting. Like, oh, sorry, I cut someone off.
No, it's fine.
Was that Ryan?
Yeah, I was just saying that actually is sort of where I was going. Just thinking about how and why we're reporting what we're reporting, and having it be more informed by where we're trying to go. So that it's clear that what we're reporting isn't just interesting set of data points. We're in a better place or we're in a worse place than we were the prior year. We have some hypotheses around why that may or may not be based on the economic environment and what we're experiencing, but we don't really know. But what we do know is what we're trying to accomplish, and to what degree is what we're presenting a reflection of our progress and what we're trying to accomplish and what resources we might need to be more successful in those areas. I think would be helpful.
So if I could add, that's kind of what we were trying to do with the youth homelessness section of the annual report. So we worked collaboratively, and instead of just giving like each of our agency data, we wove it together to create the narrative of what's happening for our students who are unaccompanied minors and the gaps in services that they have, with the final recommendation of what we thought needed to happen moving forward. And I wonder if we can somehow weave that idea with what you're saying about the action plan and then those other sections within it. But I think we accomplished that, but that will be this group to tell us how we can improve that. But we really tried to pull in the different data sources to talk about what was happening to our students and the lack of resources to support them within the state. And so the map here, what you see is the runaway homeless youth and those programs that are available compared to our ed data of who we've identified as unaccompanied homeless youth. Something we just hadn't done before. So anyway, just trying to kind of where do our gaps exist across our data sources as well as within them.
I think so. There's two things that I heard also that I want to make sure that I heard correctly. One, I think Ryan, was you had said like something along making some hypothesis based on the data. So what is the data, but also like a little bit about like maybe why, knowing that that's not going to be perfect, but I want to make sure I understood what you meant when you said, are there ways that we can make hypotheses?
Oh, I guess what I was saying is well, when Jerry was presenting, he did make some hypotheses around why we think homeless numbers are going up, right? Not necessarily the extent to which each of those variables is creating that dependent outcome, right? We don't really know. We don't have answers to that. We have an idea of what we think. But that's very different. Looking at sort of just the frequency data of homelessness and saying, what do we think may or may not be contributing to the trend that we're seeing is very different than saying, this is the direction that we're trying to go. This is the data that indicates that this is the data that's driving why we're moving in that direction and what we hope to see change in. This is the change that we've accomplished. This is the change that we have yet to see happen. It's almost like the data as we're reporting it there's steps in between what we're doing and the data that we aren't connecting the dots in the way that we're communicating. I think we are internally, like in the conversation, the way the data was presented today, I think we all have a sense of what we think. I don't know that we're connecting the dots to and thinking about who the audience is for the report and how it might help, the report itself might help us as a tool communicate and advocate for where we're trying to get to. Does that make sense?
Yeah.
And I would agree that I think that the youth section does that a bit more.
We were hoping somebody would lift it and try to get some more funding for.
Well, I-
Here you go.
Yeah.
But the one thing to think about too is it's a long report, and how many people are gonna get through
Yeah.
20 pages of information? I mean, it's really grown from
Yeah.
5 or 6 to 20, and so again, what the conversation might also have to be, this doesn't have to be everything in the kitchen sink. There can be
Mhm.
other strategic communication pieces that come out from the ICH in addition to this annual report.
like
And
that.
so maybe part of the retreat includes, like, what are those sort of, what are the issues, what are the strategic communication pieces that might be needed in addition to this, so that this doesn't become everything in the kitchen sink, and then things get lost in it. That, you know, it's hard to lift up, you know, 10 issues or whatever in one document.
What if we also started with asking folks what they use in it? So actually finding out what particular pieces are most beneficial in terms of grant writing or things like that, as, you know, within the CLCs or within other spaces. And then that way we would know what to protect as we were trying to, you know, build the case between the action plan and the data that we're providing.
Because I'd love to know from policymakers, how many of you looked at it, read it, did you read? I mean, like, who knows about it, right?
That would
Because, I mean, that's just it. Like, I think that's the other thing. Like, who our intended audiences should be the first thing, and then what are we trying to accomplish through it?
Mhm.
You know, and if there are multiple
100%.
audiences, again, maybe there's some different reports or something that come from it instead of.
Yeah, I would also say, I think leading with the data and then jumping into some of the implications leaves the door open. You know, you can take this data and you could use it to essentially inform opposite policy approaches.
Yeah.
You could say,
Mhm.
look, homelessness is decreasing, it's working, let's invest more in the system. We could also say, look, it's not working. You know, I think we need to be thoughtful about what story we're telling right from the get-go, and what we hope to accomplish. And I agree that to even get to being on the same page of what that is would require a retreat or some consolidated time, just focus on that question with a facilitator who's directing us in that way.
Yep.
I would like to hear from the ICH about how other states ICHs might interact with their legislators. Do they?
Mhm.
Beyond just letters to the governor?
Mhm.
Because if they're an intended, I mean, I'm going down the rabbit trail now, but if they're an intended audience of the report and maybe they aren't reading it or it doesn't have data points that are compelling to them or it's too much to read or whatever, maybe there's a better way for us to interact with them as one of our audiences.
Mhm. Yeah, that's a great question.
Or I guess just for this group, like, do we want that to be a takeaway
Yeah.
from the ICH?
Yeah.
Yeah, I think hearing how other states do it in their interaction is helpful. And then, you know, us having that conversation around what, you know, we would like to see.
I suspect, I mean, I don't interact with the legislature directly, but my understanding is as a younger legislature and just the mood right now is they would appreciate hearing from this council and getting that feedback, especially knowing how many bills they're gonna be facing. Like, I would think that they would be receptive to even, maybe not waiting until we meet with the USICH, but maybe just seeing if there's interest.
We went to the House Subcommittee on Tuesday last week, and they definitely had no idea about veteran homelessness and what that entailed and why. They didn't understand HUD-VASH and why landlords are not taking HUD-VASH, and so I created one-pagers that had that information of, here's the data, here's what's happening and the barriers, here's our solutions that we're recommending. And they're actually asking for additional copies of that, so that was very beneficial for us going in front of the legislation.
They want that information. That's good to know. I mean, I assume MISTA already does that, like, does MISTA provide information to the legislature or MDHHS on homeless services?
It's at their request.
Yeah,
So we don't like proactively
Gotcha.
just go meet with them on the,
Offer.
right. But, you know, I would say there's been an increased interest in this topic,
yeah,
I would say in the last year to 2 years from leadership within the legislature and other, individual members too. So, and sometimes they reach out to MISTA, sometimes they just reach out to us, sometimes they reach out to both of us, so it just depends. But I think they do see our agencies as kind of lead depending
Yeah.
on what it is they're interested in, so.
I suspect many don't even know that we have a plan to end homelessness.
Mhm.
Right.
So even just like
Some outreach could
Yeah.
work, I mean, yeah, and we can do, I mean, even, you know, through the ICH, we can do that, because it's just
Yeah.
education. When it's education, you
Right.
know, we can share all these documents,
Yeah.
we can share the plan, we can share the report. We just can't advocate, you know, but
Right.
again, the report could make the case. You can sort of make
Yeah.
the case without making the ask.
yeah.
There's a fine line
Just
there,
data.
but I am convinced there's enough, brain power around this table that we could, you know.
Or maybe is that more appropriate for the Homeless Policy Council, a less political body?
I mean, possibly, but I think we could, you know, again, part of the retreat, talk about that. I
Yeah.
think Micah could also help play, you know,
Yeah,
in a lot of ways, a lot of the state
yeah,
associations sort of play that role. I know, like, with the other hats that I wear beside homelessness, we work very closely with those state associations and sort
Yeah.
of some of this space, right? And, so it tends to work that way, so.
The name of the report is Ending Homelessness in Michigan. We're not, it's not like we're quiet.
Right,
about
right.
our
Pretty
intention.
Right.
Exactly.
I think another missing piece is philanthropy in our strategy. I think that we tend to, well, I think part of why I can see it missing is because as an agency who's a provider, and deploys the state and federal and local
Yeah.
resources from the public side, the philanthropic layer is completely and entirely critical to making any of it work when we're so deeply under-resourced as a sector. And also, there's a big challenge in translating what's happening from a public strategy perspective to philanthropy, unless you're talking to philanthropic institutions, of which there are not many, who are pretty exclusively focused on this issue. If you're not focused on this issue, there's, I think, a barrier to entry for philanthropic staff to communicate clearly to their boards why they should and why it makes sense and it's smart to invest in local services. So I think maybe a part of the retreat could be thinking that through. You know, how do we make that case easier? That would be, for example, a target audience we can think about when we're saying, you know, how does this report read? Because if we're our own target audience and we're looking to this from that lens, we might be exactly where we need to be to have the conversations we need to have. But I think that if we think about who's not in the conversation, who's not engaged, it might reshape how we communicate a little bit.
I added that
Alright.
question to all the things I've been tracking on the USICH meeting, because I think that could also be a helpful, like, what are other states doing to use philanthropic dollars? Yeah, so I did add that as a question as well. And then I just made a note around regarding the legislature and engaging with them, like, how are we, like CSH, Micah, all of you all in your roles with whatever our work is, connecting it back to the plan so that they're hearing about the plan from a variety of different people, from whatever kind of vantage point or influence that we maybe have. And so I think that's perhaps also an opportunity.
Along those lines, it's even, you know, thinking about one of the target audiences of a report like this being the governing bodies of the nonprofits that are, like I think about it from the framework of, if I was to put this in front of my board of directors, how would it help them connect the dots between what we do as an organization as a part of a statewide movement? And are they able to make that happen in a straightforward way?
Yeah.
It can become a powerful advocacy tool for a much broader number of people if it answers those questions.
Yeah.
Sounds good.
Thank you all.
All right,
I will
Lindsay,
share
I
all this
think-
feedback. Thanks.
Yeah, that'd be great, and we can do some follow-up in terms of sort of next steps related to that. I do want to leave time, because I know we're always rushed, to do roundtable. So, this is just the time for anyone, sitting around on the ICH who wants to just share something you're doing, in this space, et cetera. So, we'll start. If you don't have anything, you don't have to share, but if you do have some things that you think would be important for people to know, that would be great.
So I'm Cassie Weston. You guys probably are like, who's that lady sitting down there? So I'm filling in for Erica Hoover. She is my boss. And if you guys haven't heard, MBAA has actually added a section for mental health and suicide prevention. So Erica was promoted, and she's the manager over it. And then under there is John, who is our suicide prevention analyst, myself, who is the homeless veterans coordinator, and then we are backfilling Erica's position with women and special populations. So we'll have 3 people under her, in addition to our 2 community techs that are under our Staff Sergeant Fox grant. In the homelessness realm for myself, I'm working on going to legislation to seek funding and support for a directory. So Minnesota, who's comparable to Michigan, is currently doing a registry. We're going to change the name just because of the stigma behind registry. So call it a directory, but it's an opportunity to pull in the VA home data as well as HMIS data into one database, because the VA and HMIS don't talk. And so there's a lot of holes and gaps when it comes to veteran homelessness and capturing that information. So looking at doing a directory and then kind of flowing from that, also asking for landlord initiatives to help promote the HUD-VASH vouchers and give the landlords some incentives to take those. So whether it's a tax credit, whether it's, help with security deposits or application fees, that type of stuff. And then stemming from that, creating a veteran-friendly housing program, so that we've got our veteran-friendly employers and our veteran-friendly schools. And so creating a veteran-friendly housing program where it's a partnership between us and those landlords and housing opportunities, so that we can flow veterans into their empty units, and in turn, they are willing to accept them, and we promote them on our website and things like that, that they are veteran-friendly.
Good idea.
Some of the things I'm working on.
Great.
You're welcome.
Only 2 months in.
Great job, welcome.
Some of the things going on at DOC, we house, you probably heard me say this, but we house about 2,000 people in our temporary housing getting out of prison each year. And MSHA has graciously given us a special project-based voucher pool of housing choice vouchers. So they've allocated up to 400, but right now we have, I think, 200, and we're going up to 250. And essentially, the goal is that when people get out of prison, they can stay temporarily into housing that our contractors provide with our funds, and then they work with the clients on a long-term housing plan. So the vouchers are one of the tools for people for long-term housing if they cannot afford housing on their own. We specifically target people we think will not ever in the long term be able to afford housing on their own. And our return to prison rate for people who get a voucher is just so far below anything else that anybody has ever tried to lower recidivism. Michigan has lowered its overall recidivism rate from 45 to 22% over the last 20 years or so. For the people who get a voucher, which are our very high needs population, only 4.5% went back to prison within 3 years. So you're comparing 4.5 out of our record low of 22%, which means almost everybody that gets a voucher stays out at least 3 years. Incredible. So I would love to promote that. I get goosebumps every time I say it, even though I say it like every few days. It's just amazing to be able to do something that impactful.
We need to stand that up. That's a really good partnership between the two agencies, and the success is amazing.
And other states are jealous. Every other DOC I talk to is like, so can you help me, how do you start this? How do I get vouchers? So, yeah. Any opportunity to stand that up, I'm happy to share, or be part of that. Trying to think what else, we have quite a few things going on in the reentry space. Oh, when it comes to housing, we signed new 5-year contracts with our reentry providers and their performance-based contracts, so we added a performance metric in this 5-year cycle for people who exit housing to a long-term housing plan. I'm thinking as I read through, like making our terminology match the homeless service terminology. That's something I'm gonna put on the back burner for the future, because I think that would help. But we're calling it, long-term housing, plan.
Yeah.
I can't think of the word. But, so essentially, we're financially incentivizing based on anybody who has more than a benchmark number of releases that go to a long-term housing plan, as opposed to releasing to jail or releasing back to prison or releasing to an unknown location or releasing to a program. So it's going to be exciting in 2 ways. First, we've never measured how many of our people leave to a long-term housing location, so we don't really know if we picked the right benchmark. And when I say we, I mean me. I picked the benchmark based on the best data I had available. So, number one, we'll find out how many of our folks are actually leaving to a long-term housing location, and then we'll incentivize our contractors for doing that work, so.
Great. All right, Lisa.
Yes, just to piggyback on MDOC's success, in the voucher program, a very small set of our vouchers we're able to use to move folks into home ownership so they can stay on the voucher and purchase a home. We did have a success with MDOC with the clients that purchased the home.
Yeah.
It closed last week, so.
Okay, we
On
have
the
to talk
voucher,
after
but
that.
purchased the home, so that's
Yay, that's
very exciting for that.
That breaks generational poverty
Yes.
and crime.
Yes.
Yeah.
But just overall with the voucher program, we're still waiting for our final funding from HUD because we've had a lot of requests from special programs like this to extend their opportunity for more vouchers. But in large part, we have not pulled from our waiting list since October because of our spending and just waiting for our final FY24 budget from HUD. So hopefully get that soon. We're going to the board this week for approval of our administrative plan that governs our voucher program. So along with that is a contract for about $3.5 million to move our voucher program into a paperless arena. So we're very excited about that. And I kid you not when I say there's 28,000 paper files floating around the state of Michigan for our voucher holders, and we're just so excited to be able to move in that direction. And the last thing is recovery housing program. We just released the NOFA on Friday, so we'll be doing a webinar, I believe it's tomorrow or Wednesday, on those funds. But those are the funding we received directly from HUD. Then we do anticipate hopefully within the next month or so, we'll be releasing another NOFA for recovery housing in partnership with DHHS and the opioid settlement fund. So kind of 2-tiered there. So that's pretty much what we have going on now.
I'm going to pass.
Department of Ed, 2 things. We learned a couple of weeks ago at our state coordinator meeting at USED that they will be doing a liquidation period extension for our homeless funds for education, which is awesome because our obligation date deadline is September 30th, 2024. And it looks like we will be able to apply for up to, I think it's 15 months extension. Unfortunately, it's SEA and then every single LEA that wants to continue to use the funds. So I'm not sure how I'm going to manage this. Don't have official approval yet, but being able to spend down the remaining funds and provide additional services, it's important, so we'll figure it out. So that was kind of a fun, exciting announcement for folks. There are some advocacy groups that are continuing to press on the obligation date extension, but that does not happen. It requires that to happen. We'll go with the liquidation period. And then the other thing that I was going to mention, so with the separation of MDE and MyLead, my team just found out that the Early Childhood Task Force for Homelessness has been disbanded, I guess. The project is done. So we'll be circling back to kind of see how we might continue to relift that work for our young children who are experiencing. Great, thank you. Erica, anything you can share?
I don't know. I've left my position at ISK, and so I'm not really doing housing anymore. Contracted. I'll follow up something we're doing in Kalamazoo. Before I left, I applied for some millage funds, and we have, since October, have 2 full-time staff in Kalamazoo County schools that are working with children that are identified as homeless, doubled up, staying in hotels or places they shouldn't be. And before I left, there were 42 families that got housed since October, so.
That's exciting.
Yeah, no, we're right in there working with McKinney-Vento, and my staff are housing specialists. It's working.
Great. All right. Brian, any
I don't know if I have anything that has sort of state level implications. I guess the closest thing to it that's kind of recent and exciting is, we did, have our Pontiac City Council pass a human rights ordinance last week that includes source of income discrimination protections, which I thought was progress, given the very, very lively, debates, at the meetings leading up to it passing. I left at 10:30, and I think the meeting ended at 1. I left after it was approved, and somehow the meeting got started after that. But it was enlightening to have a better understanding of, because we're as an organization, we're on all sides of that issue. We're advocating for tenants in our scattered site programs. We have over 500 multifamily units that we own where we accept vouchers. We're sometimes tenants with clients as subtenants and have landlords coming after us for damages to their units. We kind of experienced all of it. And it was really interesting to see that conversation play out, and think about longer term how it might impact our ability to sustainably continue to provide housing for people with very low income, given the real market barriers to doing so. But if nothing else, at least we passed that, so.
Great.
It's a good thing, yeah.
All right. From MDHHS perspective, I'll give a couple of things. One would be, we're still in the thick of Medicaid redetermination, so that will continue till June or July, and in which time we will have, be through when people had to reapply to keep their, or to submit their paperwork to stay on Medicaid. We are noticing that people experiencing homelessness have been disenrolled from Medicaid at a higher rate for 2 primary reasons. One, failure to respond by the deadline and failure to return the paperwork, which we sort of anticipated because, again, just given the transient nature of this population, and we may or may not have current, a current address or way to reach them, and so they may not even have received the notice that they were due to be redetermined. So we have some exciting news, though. We've been given approval to share the HMIS numbers with each COC system admin for those that have been disenrolled in hopes that they can work with providers to do outreach to get folks re-enrolled in Medicaid. So that is huge, and the ability for us to be able to share that data back with each COC so they can sort of decide what assistance they can provide individually to those. So also, we're continuing on with our PSH pilots. We have 4 permanent supportive housing providers participating in that. It was $6 million total over 3 years, and we're seeing really positive results from those investments. Mostly, they've been able to add staff, so caseloads are down, which means, quality case management is up, meaning they're able to meet with the clients more often, provide more direct support to those clients. So we're super excited about that. We're continuing to do some stuff in the data matching space. So we're looking at mortality and homelessness. So we're trying to understand how many people died, who experienced homelessness, and their timing of that. We're also looking at location and cause of death and trying to just look at, based on what we can learn from that, what can we do in a prevention space, right? How do we get more upstream? Can we be helpful? Similar to that, we're also looking at the overdose data for the state and homelessness and trying to understand sort of what that looks like and where to better target resources sort of based on that overdose information. So continuing, with some of the stuff that Jerry talked about, sort of how we, match the HMIS data within some of the health space. These are some of the other ways that we're sort of continuing to evolve. So I'll stop there for sake of time. time, because I know we're past time and want to also make sure that we leave a few minutes for public comment if there's anyone who wants it. So, anybody still on that has public comment? Going to give it a minute just to make sure. Oh, yes.
Yeah, this
Eric.
is Eric Oppenagel with the Michigan Coalition Against Homelessness. I just want to make a comment about the ICH input and what they can provide. That was a very, I think, useful meeting to hear them talk in terms of what some of the other states are doing. I think it would be helpful for you to get something in writing in advance, which is some kind of a summary regarding some of the questions you asked, and not simply have them come and be able to present on it verbally. Because I didn't have the impression that they had that information gathered and ready to share. So just to put that out there. Also, I do want to remind people again about our Legislative Advocacy Day. I did drop the information in the chat. Hopefully that will get sent out to everybody. You're all welcome to attend. If you are going to attend and would like to be there, even if it's on the front end of things and not actually engage in any of the visits, please let us know. We certainly want to recognize you while you are there. So give us a heads up if that's the case. Also wanted to just mention that we do have our annual Breakfast of Champions event taking place on June 11th in Lansing. Would love to have you on hand for that as we hand out a number of awards recognizing people for the work they're doing around the state. More information will follow. I'll make sure that Jason has that and can send that out as we have the registration time or registration link available to everybody. We are taking nominations shortly. We'll put that information out as well in case there's anyone that you think needs to be recognized with an award for the work that they are doing. We certainly would appreciate your input on that one. And that's all I'm offering today for public comments.
Great, thank you, Eric. Anyone else wanting to make public comment? Okay. The other date, and we'll get these added, would be the Homeless Summit this year will be in Lansing in October
29th, 30th.
29th and 30th. So again, since it's local, and for those of you that are local, put those dates down, and hopefully you can attend that as well. So we'll make sure we get those dates out to folks. Okay, I think that concludes our agenda items, right?
Need a motion to adjourn?
Yep, just need a motion to adjourn. So moved. All right, Michelle, second. Who's in second? All right. Take your pick, Jason. Pick one.
Yeah.
All right, we have a motion to adjourn. All in favor, say aye.
Aye.
Any opposed, same sign. All right, thank you.